For those of you who are new to Tacoma Tree Foundation, we are a local nonprofit focused on reducing barriers to trees and green spaces in Greater Tacoma and the Puget Sound. Tacoma is the city with the lowest tree canopy in the Western Washington region at 20%. Most of Tacoma's trees are concentrated in the neighborhoods with most socioeconomic opportunities. So our energies as an organization are focused on reducing barriers to trees and green spaces in the neighborhoods with the lowest tree canopy. Among these neighborhoods is the Hilltop neighborhood, which is where we are gathered today. Hilltop has around half the tree canopy coverage as the Tacoma average, due in part to racist redlining practices that shaped the neighborhood in the mid-20th century, making it a primary housing option for people of color and people living in poverty who were not deemed worthy of access to trees and green spaces. Today, this means the Hilltop residents are especially vulnerable to summer heat, respiratory illnesses, and other negative health, social, and cultural impacts. Through our Green Blocks Hilltop program, and you can see some of the trees we helped plant in March, outside, we are reducing barriers to trees to counter this disinvestment. And though our planting and education programs are offering tree care opportunities so that Hilltop neighbors can steward their trees, this work is indispensably linked with planting and education. Across the city, the canopy goal is 30%. In order for us to reach this goal, we would need to plant and successfully care for 1 million trees. So that's one of the many reasons why we have experts like Dr. Donovan with us today to help us understand the impact of trees and how to care for trees. And we offer this education program for free thanks to Tacoma Creates, which is funded with 0.01% of your sales tax. It is currently actually being reviewed for reauthorization. So we're hoping that process transpires successfully. And with that, I'm really excited to introduce Dr. Geoffrey Donovan. He drove up from Portland this morning just to be with us here today. So thank you very much. We know I-5 is not the most comfortable route to be on during traffic hours. Dr. Donovan has a doctoral degree in forest economics from Colorado State University. For 23 years, he served as an economist for the USDA Forest Service in Alaska and Oregon. Currently, he is the owner of Ash and Elm Consulting, which is focused on making the business case for urban trees. Dr. Donovan frames his work in the study of trees and their benefits as one way to give back to trees and nature, which give us so much. His research quantifies the benefits of urban trees, including the most widely known benefits, such as reduced summertime cooling costs and increased home values, and also the lesser known benefits, which include crime reduction, lowering incidence of childhood leukemia, improving birth outcomes, reducing childhood asthma and ADHD. He has also researched the social benefits of trees, which are also integral to our mission, even tracing the relationship between tree planting programs and voter turnout. Currently, he is focusing on how exposure to plant diversity may protect against a range of immune diseases. Today, he will be sharing some of the results of his extensive research on the relationship between trees and public health and how trees and their loss impacts perinatal, cardiovascular, and respiratory health. Please join me in welcoming Dr. Donovan.
Thank you very much for that lovely introduction. And so as many of you know, or so you're aware, that trees provide a wide range of benefits. It's probably not news to anyone in this room. And they go, let's say, from intuitive benefits like carbon sequestration or cooling costs to less intuitive benefits such as reduce crime, improve social cohesion. Why then in this talk am I focusing exclusively on health benefits? Why to the exclusion of all others? Well, I think there's a clue in the title of my talk, is that urban trees are quite literally a matter of life and death. So in my view, they are clearly the most important benefits that trees provide. It's not even close. The magnitude of benefits are large, but unfortunately the magnitude of the ignorance around those benefits are also large. So unfortunately, the health benefits of trees, they're not well understood. So they're not being properly included in urban forestry decision making. That's a real problem because we're going to end up with significant underinvestment in urban trees because we're not fully accounting for these health benefits. And in consequence, our cities are going to be less green and, more importantly, less healthy places to live. So that's unfortunate. There's this old adage in economics, and I'm an economist by training, that is, if you can't count it, then it doesn't count, right? So what I'm in is the counting business, to try and count those benefits and to try and get that information in front of people like those of you in this room who can actually do something with that and make different decisions. When it comes down to it, I have a very simple message for you. That is, trees are more important than even the most ardent advocate in this room believes. I promise you, you're undervaluing trees, all of you. Which also means that your work is more important than you realize. And with that comes actually a fair bit of responsibility. I think that trees should be considered, we need to get to the point where trees should be considered an essential part of any city's public health infrastructure. And I do mean essential. Now, before I talk about specific studies, I'd like to talk about some of the problems that come up when you're doing research on the health benefits of trees. I do what's called observational research, which is what it sounds like. You simply observe the world and you try and see observe patterns in data, right? Rather than doing experiments where you go out, give people an experimental drug, or do fun stuff like put tags on narwhals or whatever it is that experimental scientists do. I don't do any of that fun stuff. I just collect data and try and see patterns in those data. Well, what is one of the problems that can arise when you try and look for patterns in data all day long is you see them where they don't exist, or rather you see causal patterns where they don't really exist. So you start to think, hey, NFL teams with more vowels in their name are more likely to win the Super Bowl, or baseball teams with white uniforms are more likely to engage on Tuesday. Now, it's not that those things may be true. It may indeed be true that baseball teams this season with white uniforms are more likely to win on a Tuesday. But I'm pretty sure it's not the white uniforms causing that. I even go out on a limb there. And if you were to take this as a betting strategy, for example, so I go betting on all white uniform baseball teams on a Tuesday, I suspect that you would not do well. So, in the case of trees and health, are there any links between trees and health? Are there any obvious links? So the thing you do is before you collect any data, you try and think, are there any links? That stops you, for example, having this white uniform on a Tuesday thing. Because the problem that happens there is you collect data and then you think up stories second. It's important to think of those stories first. So what stories or what mechanisms might link trees and health? And you don't really have to think for very long to see there's quite a few. So we know, for example, that trees can intercept air pollution, and we absolutely know that exposure to air pollution puts you at risk for a whole range of diseases. We know this for sure. We also know that if we were to go outside now and sit under a tree, your short-term markers of stress would go down. Your salivary cortisol would go down. Your blood pressure would go down. Your heart rate would go down. We know this from experimental work. Now, in this case, partly that would be because you wouldn't be listening to me, but I think the trees would do some of that heavy lifting. We also know that people who live in greener neighborhoods have more social connections. And social connections are profoundly important to our health. If nothing else, during COVID, we learned that disrupting those social connections can really have a negative impact on people's health. We also know that people who live in greener neighborhoods are more likely to engage in physical activity, and Lord knows we've all been told enough times to exercise. And then finally, just for this list, although there are plenty more, we know that during heat waves, hospital admissions and deaths increase, and we know that trees can provide shade, and they can, to some degree, attenuate the effect of heat. So, what does this tell you? It tells you that it's reasonable to hypothesize that trees may improve health. Doesn't mean they do, but you've passed that first hurdle. It's reasonable to think that it could happen. So, given that, let's go back 14 years into the mists of time to my first trees and health studies, first one I ever did, and it looked at the impact of trees on birth outcomes. Now, why on earth would I look at trees and birth outcomes? Well, one, there's pragmatic reasons. In the US, there's great data at the beginning and the end of life. So we know when people die, we have good data, and I'm going to talk about that in a little while. But we also have great data on birth certificates. We know the gestational age of a child. We know the baby's weight. We know things like the income, or the age, not the income, the education, the age, the race of both parents. The stuff that we need to know to do the type of data-heavy research I do. So that's really appealing. That's a pragmatic reason. And second, and this is really important, just as I said, there are reasons to think this could be the case. So, for example, we absolutely know that exposure to air pollution and stress puts you at higher risk of having adverse birth outcome. We know that for sure, and we know that trees can attenuate both of those things. So, hey, maybe this is a reasonable thing to look at. So the specifics of this study, I looked at almost 6,000 live births that happened to women who live in single-family homes in Portland in 2006 and 2007. And I looked at a couple of adverse birth outcomes. The first was a baby born underweight? And the specific measure there is whether the baby's weight was below the 10th percentile based on the gestational age and gender. What we call small for gestational age. It's a big fat mouthful. It just means born underweight. And then we also saw whether the baby was premature. And that was simply, was a baby born before 37 weeks gestation age? Those were our simple measures. Now, even the most ardent tree advocate in the room is not going to say that trees are the only or even the main reason that a woman has a healthy or an unhealthy pregnancy. Right? There's a whole load of things that we know. We know demography really matters. So in this study, we controlled things like income and race and education. That stuff's very important for health. We're going to come back to that time and time again. We also know that the history of previous births is enormously important. If a woman's had an uncomplicated birth in the past, she's more likely to have one in the future. So we accounted for that. Type of insurance somebody has, public or private, or no insurance at all. Type of prenatal care a woman received. And then distance to stuff. So good stuff like parks, public transportation, bad stuff like freeways. We even looked at the characteristics of a house. We thought, hey, maybe even the heating and cooling system, like having air conditioning during the summer may reduce stress on the mother. We looked at all these things. And then finally, we even looked at crime. Because we know that exposure to crime, particularly violent crime, is an enormous stressor. So, and I want to emphasize this really, really carefully. We first took account of all those things. So all those things were accounted for, controlled for. Then only after doing that, we looked at tree canopy in 50, 100, and 200 meter buffers around the center of each woman's lot. So here we have on the left, you just have a high resolution aerial photograph. You can just about see there. I should say for privacy reasons, these aren't women in the sample, they're just random houses. You have the green rectangle is just the outline of a woman's lot, and then the little red dot is the center. So what you then do is you then take that photograph, you break it into 1 meter pixels, and then use a computer algorithm to classify each 1 meter pixel as either tree canopy, which is green, or the non-tree canopy, that's beige. So that's what we have. And in this case, I've just included the 50 meter buffers for clarity, so this just turned into a circle fest. So let's just jump straight to the results. What do we find? We found that women with more tree canopy within 50 meters of their home, basically on the same block, had significantly lower chance of having an underweight baby. Well, it's kind of interesting. But, maybe this is a statistical oddity. This is the first study to look at this. Nobody else had done it before. Maybe this is a white uniform on a Tuesday, right? Could be. It's not the worst explanation in the world. And this was back in 2011. No one had looked at the relationship between the natural environment and maternal health. So, interesting thing happened though. In 2012, a friend of mine in Spain did a study, and he found that women with more greenness, and this greenness was measured with satellite imagery, so more greenness within 100 meters of their homes, they had higher birth weights. Consistent results. 2013, team in Southern California found that women with more greenness within 50 meters of their homes had higher birth weights. Well, look at that. Consistent results again. 2014, team in Germany. Women with more greenness within 500 meters of their home had higher birth weights. Okay, still in 2014, a team in Canada found that women with more greenness within 100 meters of their homes had higher birth weights. This is a particularly interesting study because the guy, you think he was at Oregon State, I met him at a conference and he was kind of aggressive, actually. He came up to me and said, when I saw that paper in 2011, I thought that was bullshit. And I did this paper just to disprove you. I was like, oh, my name's Jeff, by the way. You know, like, I mean, he really came at me hard on that one. And despite setting out to disprove the results, it ended up confirming. So this definitely wasn't a friendly paper. He tried everything he could to make that relationship go away, and he couldn't find it. Just saying. I could go on. There's been at least 30 papers since 2011 that found a positive relationship between greenness around maternal address and birth weight. So one paper, statistical oddity, no question. 30, maybe, but it's a lot less likely. I just want to take a second here and imagine if I had a healthy weight baby in this hand and an underweight baby in this hand. The two women were irresponsible enough to give me their babies. But let's imagine that. The difference between the two is a mother's exposure to trees during pregnancy. Wow, that's something profoundly, there's something fundamental about our relationship with trees. Before we're even born, it changes our physical size, right? And that stuff matters. If you're born underweight or premature, much more likely to die or have health complications at birth. Neonatal intensive care units are very expensive, not to mention grotesquely stressful for everybody involved. Keeping people out of those things is an absolute priority. And also, to some degree, you're putting a kid on a trajectory through life. If kids who are born underweight or premature, they do worse in school, they have lower lifetime earnings on average, not to say some kids don't. But you some degree, you're putting them on a different trajectory before they ever have a chance to have a say in that. And to me, I find that offensive. Like, it really does. It offends me personally. And that we could do something about that with trees. And trees are basically free compared to healthcare. Some of them come, but they are so cheap. The care of a single child in a neonatal intensive care unit routinely runs into the millions of dollars. What could you do with millions of dollars for tree planting? How much would it cost to plant 1 million trees? Significant, maybe 3 weeks of a NICU time. Not saying we shouldn't have NICUs, but even the people who work in NICUs wish they didn't have them or didn't need them. Anyway, now I think the link between trees and birth outcomes is interesting, but I would, because I was paid to do it. But it does highlight a problem. And there is a problem. There's always a but. You have the nice tree, nice neighborhood problem. What is that? We know that people who live in greener neighborhoods are healthier. We know that for sure. There's no question. People who live in greener neighborhoods are healthier. Now, is that because of the green? Or is that because people who live in greener neighborhoods are also wealthier, whiter, and better educated? We know that too. And we absolutely know that race, education, and income matter for health. No brainer. So is it demography? Is it green? Or is it a little bit of both? Right? We don't know. The problem is they're correlated. So pulling that apart, that sort of demography, health, tree, sort of love triangle thing, it's really hard to pull apart. Couldn't think of. Probably not the best choices. Triangle. Completely, no love at all. Right. And I was worried by this problem. So you're never quite sure if your results are because of the results because of the trees or they're because of the demography. You take steps to deal with it, to control for things, but you can never be completely sure. Okay. About 12 years ago, this was bothering me more than usual. And the one time in my life when anxiety actually paid off, and this is this one. So it really is. It wasn't worth it at all. But I realized, okay, if my general hypothesis is trees are good for you, would you agree then that killing them should be bad? There's a corollary, that one thing would logically follow from the other. Okay, why does that matter? Well, because trees can die a lot quicker than they can grow. So you could see changes in tree cover in a relatively short amount of time. And that's enormously important. So methodologically, you don't have to wait decades. People move, it's very difficult. If you have a change in tree canopy in a short amount of time, that's certainly methodologically appealing. And even more so, it's appealing is that tree loss might allow you to sidestep that nice tree, nice neighborhood effect. Because we know at one point in time, if we look around a neighborhood, yeah, I know we're in a poorer neighborhood because I didn't see any trees driving in town. So I don't need to look at the census website to know about this neighborhood. That's not an insult to anybody, right? It's just statistical reality. But it's interesting, this happens around the world. It happens in the global south. It happens in the most egalitarian countries in the world, Scandinavia. It seems to be like a fundamental law of urban living. It really is. So trees are related, across space, across a city, for example, they are related to income, education, and race, and you can't really undo that. But loss of trees over time need not be. It could be, but it need not be. We could lose trees over time in a way that was uncorrelated with those. And that would be awesome. So we would need two things to happen. We need a lot of trees to die in a short amount of time. Just because your neighbor Bob cuts down 2 bushes, you don't expect that to be some sort of public health apocalypse, right? You need a lot of trees to die in a short amount of time just to see a measurable effect. And you need that loss of trees to be uncorrelated with other drivers, demographic drivers of health. What could do that? Well, anybody know who this handsome little devil is? You're about to know if you don't. Yeah, this is the emerald ash borer. Unfortunately arrived in the West Coast near me in 2022. It's either in the Seattle metropolitan area or will be soon. For those of you who aren't privy to what it can do, this is a street-lined tree in Toledo, Ohio in 2006, and the same street 3 years later. Absolutely devastating. So it does satisfy that first condition. It's clearly going to kill a lot of trees in a short amount of time. But would those loss of trees be correlated with changes in race, education? Well, let's look at a little animation here. This shows the spread from Detroit in 2002, where it's first discovered, all the way out to the West Coast. Can you imagine race or education or income changing in a way that mimics this? Demography doesn't change this way. This is a wave of a pest. And I'm not asking to sort of just eyeball it. I've also statistically looked, right? This change, the spread of EAB is uncorrelated with changes in race or education or income, just because they're very different processes, right? They change in very different ways. So you've got a really great opportunity, because if we found that EAB was related to changes in health, we would know it's not because of health, right? We know it's not because of race or education or income, because we've got this unique pattern. So this is pretty cool. This is enough sort of statistical geekery. Let's get on with it. So what health outcomes do we look at? Well, we looked at cardiovascular disease and lower respiratory disease. Why those two? Well, they're very important. They're the first and third biggest killers in the US, so they're important. We're not looking at toenail fungus, we're looking at big killers. Also, there are good reasons to think that trees could affect them. Stress, air quality, exercise, all those things can be influenced by trees, and all those things definitely influence these 2 causes of death. Now, on this map, the black squares there are counties. So what I looked at was county level mortality from 1990 through 2007. She had this long running period with no bug, trying to understand that what drives mortality, and then you drop in the bug and wait for 6 years and see what happens. And what we found is that EAB was associated with significantly higher rates of cardiovascular and lower respiratory mortality. Very significant relationship. Interestingly, that relationship increased in both significance and magnitude as an infestation progressed. So as more trees died, more people died. We actually saw a dose-response relationship, which is what you'd expect. You would expect as more trees die to more people die, if that was the true relationship. We also saw a bigger impact in wealthier counties. Why would that be? Anyone? Because you have more trees in those counties, bigger health impacts, you take them away, bigger negative health impacts. It's what we would expect to see. And we found across 6 years, 15 states, an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory disease attributable to EAP. So an additional 21,000 deaths is not a trivial number, obviously. So when you get results like this, they're really impressive. What you need to do is keep your mouth shut, quietly shut your office door, try and disprove. Because if you do, then you face private disappointment. If you release them early and somebody else disproves them, then you face public humiliation. Having experienced both, I can tell you which one is better. So how did I try and disprove it? Well, I looked at a cause of death that couldn't possibly be influenced by EAB, accidental death. Right. Beetles are not causing car accidents. There's no impact there. They shouldn't. This is what we call a negative control. Sometimes it's as important to find there isn't a relationship as to find out there is one. And we didn't. There was no relationship between EAB and accidental death. So we found that EAB was related to 2 causes of death it could influence, that is cardiovascular and lower respiratory disease, and it was not influenced. Did not influence a cause of death it couldn't possibly affect, that is accidental death. Is this definitive? No, but it's certainly encouraging. Now, since I did this original research, several studies have confirmed the findings and sort of shed light on the mechanisms. So this study was interesting. It looked at the relationship between EAB and the likelihood that people engage in outdoor recreation. Remember, exercise is one of the possible ones. So we're going to look at this graph here, this one at the top. So the vertical axis is the probability that somebody engages in outdoor recreation. And then the horizontal axis is time. And this is when EAB arrives. So you see it's going along, EAB arrives, there's a significant drop in the probability that people in the county engage in outdoor recreation. And that stays significantly lower for 5 years. It does ramp up, but even after 5 years, it's significantly lower. So it suggests that physical activity may be one of the mechanisms linking EAB and mortality. Now, some of you are in communications, right? So you like this next bit. So as we talked about, you need to be able to get this information, if you're a scientist, you need to get it in front of people who can actually use it. And one of the methods to sometimes do that is to talk to reporters. Not my favorite thing. And I've talked to quite a few, and it can be a bit bleak as an experience. But a few years ago, I was contacted by a reporter from Wired magazine, and he was better than normal. First, he'd actually read the paper, which it's almost like reporters are ethically obliged not to. They don't read the paper, but he had. He was also a science reporter, so he had some good questions. So I wasn't as terrified as I am normally. But then when he sent me the paper, maybe I should have been. So this is what it was. So you see, just a tiny bit of nuance lost. My wife's a science writer. She laughed so hard, I thought she was going to hurt herself. I was just sitting there with my head down. Anyway, just a cautionary tale of science communication. So I think the results from the EAB study are pretty interesting. Again, I would though. But in the years since I did the study, I've wondered whether the opposite is true. That is, if killing trees causes increases in mortality, does planting trees cause decreases in mortality? You would think so. In fact, it's difficult to see a situation where this is not a symmetrical relationship. It would have to happen. You couldn't argue, if you didn't find that, you couldn't say, well, loss of trees is bad, but planting is, no, it doesn't make sense. It really does need to be a symmetrical relationship. The problem is, as I said, they take such a long time to grow. So it's just practically more difficult to look at. You'd need decades of tree planting data to really study an impact on health. I didn't know where to get this. I asked the city of Portland, they couldn't find their own tails, so they definitely weren't helping me a great deal there. And then a few years ago, I just happened to talk to a friend of mine who works for Friends of Trees in Portland. And she just mentioned in passing, oh yeah, we have this little spreadsheet. We have the address and the date where we planted 50,000 trees since 1990. I said, what now? And I said, can I? And they said, oh yeah, you can borrow it, absolutely. So that was really nice. So I've got these 50,000 trees, mostly street trees, a few yard trees. So I know when and where they were planted. Great. So now I need some health data. So I contacted Oregon Health Authority and I got access to census tract level mortality data. Census tracts, for those who don't know, are they're just geographic units used by the census. In Portland, there's about 140, which means they're roughly the size of a named neighborhood. So you can think of the results here as we're looking at neighborhood level mortality. So that's what we do. And for each neighborhood, we calculated, for each neighborhood in each year, we calculated two planting variables. The number of trees that had been planted in the last 15 years, which is total trees, and the number of trees that were planted 1 to 5 years ago, 6 to 10, and 11 to 15. Why that? Well, because we would expect, a priori, we would expect as trees age and grow, they would have a bigger impact on health. You would think so. They're going to absorb more air pollution, more shade, presumably more stress reduction, one would think. So you think, okay, we want to see that impact go up over time. If it doesn't, then maybe there's something wrong with our study, maybe we can't trust the results, or maybe we have a misunderstanding of that relationship between trees and health. Because when you do work like this, it's important not to go easy on yourself, right? You need to really take yourself over the hurdles. So that's what we did. And also I should say, in this first part of the study, we looked at simply non-accidental mortality. Why is that? Well, for the reasons I said before, trees and not planting trees or losing trees isn't going to affect accidental mortality. So in these studies, you typically take it out and you're left with non-accidental mortality. So illness stuff, you know, rather than car accident stuff. And so this table here is very simple. We found 5 things, 5 variables were related to, remember, neighborhood level non-accidental mortality. So we're looking at that. The first was neighborhoods with higher income had significantly lower mortality. Not surprising at all. We see this all the time. Income, being rich is good for you. Really, really is. I would recommend it from a well, not from a personal experience, but I think it does well. Age, neighborhoods where people are older, unsurprisingly, people aren't immortal. That's the sad news there. Education, neighborhoods with higher rates of education, significantly lower mortality. We see this all the time. It's not, this is just reproducing the results we would expect to see. Race wasn't significant. It was mildly surprising. A couple of reasons for that. One, we already had education income model, control for that. And then Portland's very white, so it's just not that much variation. So a couple of things there. So that's all the throat clearing. That's the stuff we have to have in the model, but we don't really care about. We just sometimes call them nuisance variables. They're just in, but that's not what we really care about. We care about the trees. So what about trees? We found that neighborhoods that had more tree planting in the last 15 years had significantly lower rates of non-accidental mortality. Okay, well, that's good. But sometimes you get relationships that are statistically highly significant, but the magnitude is so small that you don't care. So if I found, for example, that planting a tree increased somebody's life by 37 seconds, very significant relationship, be kind of cool from an abstract sense, but it wouldn't matter. So we have to see, is this big enough to care about? So across the 30 years of the study, Friends of Trees planted an average of 1,638 trees. So that's the average mean amount. And what we found was that this number of trees was associated with 15.6 fewer deaths a year. That's every year, almost 16 fewer deaths. in a city of 600,000, that's not trivial. Another way to look at it, which I think resonates better with me, roughly speaking, for every 100 deaths, 1 death was averted. So 100 trees isn't all that many. So now let's look at how that relationship changes as trees grow. So this little table, what we did is say, let's take those 638 trees, let's wait 1 to 5 years after planting. So they're not 1 to 5 years old, they're 1 to 5 years after planting. They're roughly 4 to 8 years old at planting. So 1 to 5 years after planting, we found that they were associated with 11.6 fewer deaths. Okay, that's good. But now let's wait 5 more years, let them grow a bit. 19.7 fewer deaths across the whole city. And then 11 to 15 years, 23.1 fewer deaths. So we saw what we were hoping to see, which is this sort of relationship. It goes up, but at a sort of declining rate. So the magnitude and significance goes up over time, which is what we would expect. And there's a number of really important messages from this graph. One, this goes up over time. Bigger trees matter. It's what we would all expect. And that means that retaining mature tree canopy is at least as important as planting trees. Planting trees often gets the most attention, but retention of mature canopy is really important. Also means when EAB comes along, from a public health perspective, it's really good to avoid sudden loss in tree canopy. So in the early days of EAB, some communities would just preemptively cut down all the ash trees. Not a good idea from a public health perspective. You're going to have impacts. So in this case, using pesticide treatment to keep mature trees alive or to do a very gradual replacement, that makes more sense. Really best to avoid big losses of mature canopy. It's not a good idea. Let's see, where am I? So, right. So this paper was, to some degree, it was intended to be a companion paper with the EAB. And in that, we looked at cardiovascular and lower respiratory disease. So we looked at those two here. And what we found is that there was, in neighborhoods that had more tree planting the last 15 years, significantly lower cardiovascular deaths. Highly significant. That was great. What about lower respiratory? This was marginal. At the 5% level, it was at the 10, just about, so not really there. But clearly in the case of cardiovascular disease, a highly significant result. And then we went to look at accidental death too, because remember, we want to make sure that there is no relationship there, because if there was, that would be hard to explain. And we found there was not. So that was pretty cool. And I want to take a moment really to consider how consistent these two papers are. The EAB paper and this tree planting paper. They were conducted 9 years apart, these two studies. They had different study areas. One was a city, one was a region. They had very different measures of tree loss or gain, quite profoundly different. Different statistical models. So they were very different. Nonetheless, despite those differences, which were profound, we found that in the EAB study, losing trees was associated with increased cardiovascular mortality. And in the tree planting study, planting trees was associated with lower cardiovascular mortality. Also, in both relationships, we got a dose-response relationship. The EAB study, as more trees died, more people died. In the tree planting paper, as the trees got older and bigger, there was a bigger impact on death. So that's a big deal. For those of you who aren't scientists, the consistency between the two may not seem like a bigger deal. It is. You don't get consistency like this very often between two very different papers. So I think taken together, they really, really increase the body of evidence that tree planting is associated with low mortality, particularly cardiovascular mortality, which, to repeat, is the biggest killer in humans. Now, because in this study, a lot of green health studies use satellite measures of greenness, right? But in this study, we were looking at doing an actual thing. picking up trees, putting them in the ground. So because of that, we were able to do a cost-benefit analysis. So I'm an economist by training, so I can't help myself to do that sort of thing. And my co-authors indulged me. So I said, okay, let's look specifically at the costs and benefits of planting one tree in each of Portland's 140 neighborhoods. So 140 trees. So to make a couple of assumptions. For the costs, we found that the 2005 study, we accounted for inflation, and the mean annual maintenance and planting cost of a tree is $58.07. Okay. So if we multiply that by 140, that gives us the cost of $8,218, right? So that's the cost of planting trees. How on earth do we come up with benefit calculation, right? How's that possible? How do we come up with an economic value of saving lives? Well, it turns out the EPA has to do this all the time. And I won't go into the statistics behind it, but they value a human life, well, not a particular human life, it's not like yours, but abstract, anonymous human life at $10.7 million. That's the value of saving. They didn't just make this up. It comes from some survey data, also comes from how much people require to do dangerous jobs, for example. You can use this to infer how people value their own lives. So $10.7 million. My model suggests that planting 140 papers would be associated with 1.33 fewer deaths. So you take 1.33, you have a value of $10.7 million, you multiply it up, the benefits are $14.2 million. So remember, the costs are $8,218, $14.2 million in benefits. That's a benefit cost ratio of 1,727 to 1. Even those Nigerian email scams used to get wouldn't have claimed those. They would have, get 10 to 1 something. This is preposterous. These are flamboyant in its benefits. It's just amazing. And why is that? Well, really, remember, human life is valuable, which makes healthcare expensive, and trees are cheap. Things to remember. And so, what can you take home from this study? Well, a few things, I hope. One is trees can literally be a matter of life and death. If you can remember nothing else, remember that. And they also provide benefits throughout a person's life course, from before you're even born to extending life, right? And I've also done studies on trees and asthma, childhood leukemia, ADHD, surgical recovery in older people, hip and knee replacement. And then, not to mention, that's just my work, research by other scientists, showing an association between tree planting and a wide range of health outcomes, including mental health outcomes. And these benefits are provided highly cost effectively. Important to remember. And then this is also one that people forget. Trees are a modifiable part of the environment. You can do it. Trees can be planted tomorrow, just about anywhere. It's easy. If you found, for example, that living next to a national park was good for your health, I bet it is. I mean, one would imagine, probably is. How useful would that be from a policy perspective? Not there. We can't put a national park in this neighborhood. We can't even put a little pocket park in here, probably. So it's hard to do. Trees they have an impact on health, they're cost effective, and it's an easily modifiable part of the environment. To me, it's not a matter of should you be planting trees, but can you morally justify not doing so? I don't make value judgments very often in my work, but now I'm out of the federal government, I can say things like that. And I think it does become a moral question, particularly in neighborhoods that are suffering from other inequalities, like the neighborhoods we're in now. Can you justify not spending that money? Maybe, but you're going to have to convince me. And really, once you start accounting for the cost, the benefits, the health benefits of trees, any tree planted in a reasonable location, just something goofy like plant redwood right next to the foundation to the house. But any tree put in a reasonable location, the benefits are going to far exceed the costs. So it does done with the calculation. Just there. It is. So, thank you very much for your time and your attention. It's been a wonderful audience. I would happily take any questions, of which no doubt you're thinking, is this the world's cutest dog? And yes, it is. This is Georgie, my 12-year-old puggle. Again, thank you for your time.